I want to ask about testing before we talk about vaccines. You and I have talked a lot about testing over the year, and I think you've said, and we've had this conversation a few times, that there has not still been adequate testing in terms of overall numbers in this country. I want to frame the question a little bit differently, Dr. Fauci. For people who don't have symptoms, they're asymptomatic, they just want to get tested to find out if they are in fact positive, what exactly should they be looking for? Because if you have symptoms, you should stay home. If you find virus on one of these PCR tests, it could be active virus, it may not be active virus. If you're just trying to find out whether or not you're contagious, which seems to be the question you're really trying to answer. I have no symptoms. I want to get tested to make sure that I'm not contagious to other people. I don't care if the test comes back positive. I just want to know if I'm contagious. Can we answer that question? Could the average person answer that, what seems to be a fundamental question at this point?
Well, Sanjay, in order to answer that question completely accurately, I think that our listeners and viewers need to understand that there are tests for different purposes. You mentioned one of them. If you've been exposed, either symptomatic or not, and you want to find out if you are infected specifically at this moment in time, then you want the more sensitive, more cumbersome, more expensive PCR test that you can't get in 10 or 15 minutes. It's going to get at best a day and sometimes 2 and 3 days. If you're looking to get a feel for what the penetrance of infection is in a particular group, in a college, in a factory, in a nursing home, even though there is no one there that's having symptoms, you can get a feel for that by doing a less sensitive test more often. Let me explain what I mean. So let's take the antigen test, which isn't as specific or as accurate as the PCR test. If you get tested 2 or 3 times a week, the lack of sensitivity of that test will be made up for by the frequency with which you get it. The other point that I believe you were referring to, Sanjay, is that even though the sensitivity might be lower in the antigen test that's more of a screening test, if you wind up getting a level of virus that is not picked up by the antigen test because it's so low, you could be infected, but your virus is so low that you are not infective. Right. Namely, you're not going to transmit it because it's not picked up by the antigen test. You likely would pick it up by the PCR, but what we call that the cycle threshold would be at such a level that even though you pick up virus, it's not at a level that you're going to transmit.
Right.
So I think that's something we're learning more and more about. The more information we get, the more confident we'll be as to whether or not these tests can be used on a basis of screening to tell you at least I'm not infective to someone else.
I think this is such a fundamental point, because ultimately, how do you make these sorts of tests actionable in people's lives? Somebody that's taught me a lot just from reading his work is Michael Mina, who you know as well, Dr. Fauci. As it turns out, he's joining us right now. He has a testing question. Dr. Mina, are you there?
Testing is one of the most crucial public health tools to fight a pandemic. However, in the US, we view all tests through a single lens, which is for clinical medical diagnostics. This is because we have only a single pathway for evaluation of tests throughout the FDA. But for tackling a public health problem, we need tools tailored for public health. Tests must be accessible, they must be fast, and they must be frequent. Is there a role for a new pathway for evaluation of tests focused squarely on public health metrics, which is distinct from medical diagnostics?
Well, he's asked the question after I gave the answer, which is good. No, his question is totally relevant, Sanjay. And I know I've listened to Dr. Minner make that point about the difference between testing for a medical reason and testing for a public health reason. And that is a very important issue that I think we need to pay much more attention to, because it really addresses the question you asked me about not necessarily definitively knowing if this symptomatic person is or is not infected versus, from a public health standpoint, what's the level of infection in a college dorm, right, or in a factory or in a prison or in a place of employment? That's what Dr. Min is talking about. That's a public health question as opposed to a specific medical question.
Do you think that we would ever get to the point where we would be able to have the type of testing Dr. Mina is talking about? He is describing doing regular at-home testing, antigen testing, again, lower sensitivity, but maybe because you're doing so many of them, able to give you information that's actionable in terms of whether you're contagious. I bring this up, Dr. Fauci, not to keep belaboring this point, but we heard the 3 pillars that President-elect Biden talked about yesterday: masks, vaccines, schools. I feel like testing, again, has been inadequate all along and is still very important, especially over the next few months. Could we get to that point where we have, tens of millions, hundreds of millions of tests?
Sanjay, there's absolutely no reason why we cannot get to that point. We have done things infinitely more complicated than that. We have the technology. We can do it. We can get home tests that are point of care, sensitive, specific, cheap, without the necessity for a prescription. That's eminently doable. And when we get there, we can have yet another dimension for being able to control this outbreak by understanding literally in real time what the extent and the penetration of infection is in any given segment of the community.
Let's talk about the vaccines for a minute. And there's several questions that are coming in about this as well.